Collaborations that work, making a difference for students from disadvantaged backgrounds. I'm Barbara Robin, a pre-professional specialist and retention counselor in the Student Academic Success Center. Over the last 20 years, my main focus has been working with students pursuing their dream of becoming health professionals. It was listening to the student stories about their experience volunteering in the UC Davis student-run clinics and to their stories about the challenges they were facing navigating the rigorous pre-med requirements that inspired me to pursue the collaboration with the medical school, resulting in the seminars you'll hear about today. Whether it was Amani Clinic or Clinica Tapati or Knights Landing, the common thread among the students was a passion to make a difference in their communities. One of the goals of both seminars you'll hear about today was to bring resources directly to students in a supportive, interactive environment. You've all heard that it takes a village to raise a child. Well, these seminars required the input and participation of faculty, staff, undergraduate and graduate students, medical students, and physicians. With the assistance of Arnett Bates, the director of our EOP program on campus, we were able to offer the seminars to the students we felt would benefit the most. Last fall, we offered the first seminar, Healthcare Crisis, Community Clinics Making a Difference. We offered it to 16 students. Due to the positive feedback from students we received and the demand for the course, we repeated it again winter quarter and also designed a new seminar, Pre-Med Journal Club seminar, Future of Healthcare for Underserved Populations. Joining me today to talk more about collaboration are Dr. Darren Lattimore, Associate Dean of Student and Resident Diversity from the UC Davis School of Medicine, Ed DeGang, manager of the student-run clinics at our medical school and also a pre-med advisor for UC Davis School of Medicine. And I've also brought with me today, I'm pleased to say, 3 undergraduate student leaders who are going to talk about how the seminars impacted student life. We'll start with Dr. Lattimore, and if I could ask you to hold your questions until the end so that everybody gets a chance to speak. Thank you.
I don't normally use a microphone, but I'm going to give this a try. So let's see how this goes. So again, my name is. So my name is Darren Lattimore. I'm the Associate Dean of Student and Resident Diversity at UC Davis School of Medicine. I arrived in 2008 when we actually started the Office of Student and Resident Diversity with this naive belief that I was going to somehow transform UC Davis School of Medicine into a mecca of diversity, be it race, ethnicity, be it gender, gender identity, or be it economics. And I thought, how hard could that be? The students are there, we've just got to admit them. So in our work in our office, we actually, just a general thing, our office actually does outreach K through 12. We bring about 1,000 high school students in per year. I should say actually elementary through K through 12, about 1,000. We're revamping that to think more in terms of quality of experience than quantity. But I'm just telling you historically what we do. We do a lot of outreach to undergraduate programs, and we'll talk a little bit about those today. And then we do a lot of mentorship of medical students who self-identify as socioeconomically disadvantaged in our medical school, a lot of mentoring and programming with them. So when I first came and I looked at our medical school class, again, my whole goal and the reason why I was hired was to add diversity to it. So we can just be honest and frank up front as to why I came. And so we already had a post-baccalaureate program, which is extraordinarily successful. We take in about 20 to 25 students per year. And our post-baccalaureate program are for students who definitely have a passion to go into medicine, but unfortunately their matrix, as far as GPA is concerned, and or their MCAT scores, the exam that you have to do to get into medical school, is not what you need to get in. And we were very successful in getting students from our post-bac into medical school. the demographics of our post-bac weren't what I was looking for exactly. Shortly after I came, we started a second program, MSPEP, Medical Student Preparatory Enhancement Program. It is for juniors and seniors, predominantly of which come from the UC Davis campus, but we do take a few from Sac State also. And these are students who have more of a GPA that's actually competitive to get into medical school, but could definitely use some advising, help with actually the application process, and often don't have the economics to actually do a formal MCAT prep. So our program, which starts in November, starts at the beginning of the year, actually pays for MCAT prep. We pay Kaplan directly. We contract with them. In the summer, we actually give the students a stipend of which to live off on so they can just focus on studying and not trying to work, etc. And we also actually work with them directly on their application. We take about 15 to 20 students, and again, the majority are from Davis. They have to show me as part of their application their financial aid statement so that I can actually document that there really truly is an economic need. So again, I start this program, I'm like, okay, we're paying for Kaplan, we're giving giving a stipend to live off of the summer, you have an associate dean who's gonna write a letter of recommendation for you, on and on and on. The minority floodgates should just flow through my doors. Obviously, I was still quite naive in that. It was extraordinarily surprising to me that we had this program for juniors and seniors of our campus and how few of the historically underrepresented in medicine students actually applied to the program. So that gets me to why I was extraordinarily eager when Barbara actually brought this idea up to me, because it became very clear to me I needed a pipeline program into my pipeline programs. It became very obvious to me that I was starting too late and that we needed to figure out how to start to touch student lives who come from socioeconomically disadvantaged backgrounds at an earlier step in the process, be it freshman, junior. And when we first started talking, we actually talked about freshmen. And then we talked about the pluses and minuses of that, and we've actually started to actually work more with sophomores with the intent next year of actually having a separate seminar for freshmen. So, and I don't know, does anyone in here actually help run or coordinate a graduate program? Okay. You used to? Then you can understand if one of the missions of your program is to diversity, and no matter how you define it, how difficult it can be to even get people from diverse backgrounds to apply to your program, and it's very hard to accept someone into a program who does not apply. And so that was really, from the School of Medicine's viewpoint, why this collaboration was so important, so that we could start developing literally a cohort of students who come from socioeconomically disadvantaged backgrounds at the earliest stages, groom them, mentor them, and more importantly, keep in touch with them as they actually go through the process, and hopefully graduate them from this seminar to the MSPEP program, assuming that their GPA is where they need to be to get into medical school, and if not, graduate them into our post-baccalaureate program if they actually need some help on GPA and or MCAT. I'm not going to say that this, because it would be a falsehood, that this program is the reason why the diversity at the medical school has changed so significantly, but I will say it is a part of it. Since I actually have come to the school, our students who self-designate as disadvantaged, and specifically those who come from historically disadvantaged backgrounds, and I came in 2008, is double, literally double. Of our 110 students who started school when did we start, in July? Of the 110, 46 of them identify as historically from underrepresented communities, and 60 out of the 110 identify as socioeconomically disadvantaged. And again, for anyone who actually is really working on not just getting students into undergraduate, but making sure that they actually go to professional and graduate schools, my real take home for you is waiting until it's time for them to apply to your graduate program or your professional program is too late. That we really need to be thinking about capturing these students as they're walking in our door as an undergraduate and working with them every step of the way if we really honestly want to make sure that they have the matrix and whatever standardized tests that you need to get into your programs, if they're going to have that under their belt and still have the self-confidence to go to professional school, then really honestly I will be thinking in terms of sort of the collaboration that we've created. And I'll answer any questions that you guys have for me after the rest of the panel gets through.
Good afternoon. My name is Ed Dagung. I'm former admissions officer for the UC Davis School of Medicine, and for the past 3 years given the opportunity to serve as the manager for our student-run programs, working with our wonderful medical students, but also the strong leadership of our undergraduate student staff who serves on the boards for the student-run clinics. Included in the packets that were handed out to you earlier, information about the clinics, the different clinics, their locations and telephone numbers. Primarily the theme and the common thread among the student-run clinics is bringing medical care to underserved communities. And the UC Davis School of Medicine has operated student-run clinics in inner-city neighborhoods now for over nearly 40 years, providing free health care to uninsured, low-income, and other underserved populations. The clinics serve distinct groups of patients, providing them with culturally sensitive health care in its respectful and comfortable environment. Many of the patients' English is not their first language, so we have medical students as well as undergraduate students that serve as interpreters, working with the community physicians and the medical students who volunteer their time at these facilities. And for many of the patients, this is their only access to health care. Listening to our medical students that serve as the student leaders, we have patients coming from the Bay Area because their facilities aren't located there. And for many of these patients, they start standing in line at 6 in the morning waiting to be seen. And the ability to see patients is relying upon the number of community physician volunteers who are able to provide mentoring to the medical students and undergrad students, but also teaching to the medical students who volunteer at these clinics, but primarily being able to serve the patients. So that's a challenge that we have every year with regards to the student-run clinics. Now with the Healthcare Act, the clinics have said that the number of patients they see have declined, but the clinics do continue to serve undocumented individuals. So they provide those clinical services to those communities that are able to access the healthcare system. And as I said, the clinic is served primarily by licensed physicians. They volunteer their time, oversee the patient care, and lastly, the School of Medicine student-run clinics program has been nationally recognized. We have 7 student-run clinics in the Sacramento area. I will tell you a large cohort of UC Davis undergraduate students volunteer at these clinics every year. In fact, the applicant pool probably amounts to about 200 to 300 applications for only 30 to 40 spots in these positions. And I am happy to say that many of the undergraduate volunteers over the years have entered our medical school as students and then have continued their experience in the student-run clinic as student leaders at those clinics and continuing to help the community in that way. So we've definitely had success with this. My work with Barbara Robin with regards to the seminars has taken place even before the student-run clinic seminar that she spoke about. And when she proposed the idea of focusing on student-run clinics, the opportunities, how undergrad students will learn and gain and develop from those opportunities. I jumped on the opportunity to participate on that. And as Barbara has shared with me, many of those students from the seminars, not knowing about the student-run clinics or knowing about the student-run clinics and not being successful in their application process of the clinics, are now in the student-run clinics, and they've gone beyond just volunteers and taking on leadership opportunities in those clinics and helping them continue to make them successful for the community. And I think that's a really great achievement in terms of just one seminar and the impact on less than 50 students and how they've really gained and benefited from that experience. So I'm really happy to be involved with that.
Really honestly, our student-run clinics have really allowed UC Davis in a huge way to do a level of community engagement that does not exist on any other campus in this country. There is no other school in the entire country that has a number of associated free clinics. Matter of fact, we are double to triple the average school in the rest of the country that has a medical school attached to it. And also, which hopefully our students will talk about, is these experiences really give them the platform to really understand what medicine is like and really get a sense of, are they really interested in being a doctor or anything medically related. And also, it's a platform for the day after that horrible OCHEM test to rejuvenate and say, this is what it's really about. Pick themselves up off the ground and keep moving.
If I may, I talk with my hands, and so I would like to stand at the podium if that's all right. Perfect. Can everyone hear me just fine? Okay. Oop. Okay, hello. My name is Jasmine, and I am a third-year plant biology major, and I am also a volunteer in the student-run clinic, the Imani Clinic, located in Oak Park, Sacramento. Also, I am an orientation leader here on campus, and during the academic year, I'm proud to say I'll be a peer advisor. I first heard of the seminar from Barbara Robin. She's my mentor, and we were paired together via a mentorship that was facilitated by the Linda Francis Alexander Scholars Program. It's a program on campus that aids in the success of African American students in African diaspora. And so I felt that this mentorship was the stepping stone for me learning more about the resources that were available on campus. I'm a transfer student too, and so I was not aware of many of the opportunities that would be presented to me here at UC Davis. The class specifically appealed to me because where else am I going to get the chance to sit at the same table of such esteemed professionals? That was never even an option at my previous school. I had never met a physician other than me getting a checkup, so there was only that option. I never was able to interact with physicians, psychiatrists, lobbyists. These are people I would have never otherwise have met. A very unintended outcome and impact from the seminar was the strengthened bond that I was not anticipating between 12 complete strangers. There was a group of 12 of us coming together, sitting at a table once a week, discussing hard-hitting topics, ethical questions. We were digging deep into who are we as prospective medical students, as prospective just students, period, as people. We got into really controversial topics, ethics, and we were able to discuss a variety of issues that better prepared me as an applicant for the Imani Clinic. We discussed things such as cultural competency, and we also discussed really difficult issues, including do not resuscitate, things that I would never otherwise get to discuss in such an intimate setting in any other class that I have attended. A really memorable moment that occurred in the seminar, it lingered with us long after it ended, was when suddenly Barbara brought up a history of cancer in her family. And if you could imagine, the way that it just had a snowball effect, and every single one of the students sitting at that table had a similar story. I can't even say how real the bond was when we heard each and every person also relate to a story of pain, of disease in their family, of losing a loved one perhaps. And so it was beyond words. I wanted all of you to actually close your eyes at this moment. Trust me. And try not to fall asleep. So please, keep your eyes closed and raise your hand if you have had a loved one affected by cancer. Keep your eyes closed. Okay. Open your eyes and please look around you. Keep your hands up. Is that astonishing? That's exactly the moment that we had in the seminar. All of a sudden, we realized, hey, we're not 12 strangers coming together, just sitting at a table, wondering if medicine is the right path for us. All of a sudden, it became real. No, we are 12 people who are united by something we had no idea even existed. No one else knew that I had a mom who had stage 4 colon cancer. No one else knew that about me. But then we found out more about each other as well as ourselves through that process. That was the impact of the seminar on me as well as other students, as you'll hear later on through their quotes that they left in their statements about how much the seminar actually impacted them. Okay.
Hi, my name is Elizabeth. I am a third-year biological sciences Chicano Studies double major. I am a volunteer at Clínica Tepati, and I'm a board member of CHE, Chicanos and Latinos in Health Education. And I was also in both the fall and winter seminars with Barbara here. Okay, and I first remember hearing about these seminars like in an email in the middle of the night from EOP, and like me just myself thinking, I don't think I needed these seminars. A lot of the topics that were going to be covered, I had already known about because of my involvement in CHE. We do have a lot of speakers come in and they always give talks. And so in that sense, I felt, do I need this class? So I was just thinking about that. And then also I saw that it was really being put together by South Hall Pre-Med Advising. And that's something I had never gone to before. I didn't think I needed pre-health advising. But yeah, so I just didn't think I needed it. And for me personally, as a Chicana, I find it difficult to ask for help in a setting that I've never been to before. I was uncomfortable. I was hesitant. But yeah, little did I know that what really got me into the seminar was the emphasis on student-run clinics. Because previously, I had applied to be in a student-run clinic and didn't get in, me thinking that I knew it all. So I thought, if anything, I'll just learn new perspective, new insight from this class. And that's what I did. And so, wow, just this class was really such an experience for me. Yeah, when people ask me about this class, I always say that it really connected the dots for me between the things I was a part of and the things that I wanted to be a part of. So I wanted to be a part of a student-run clinic. And everyone always just asks me what this class is about, how it runs, and I always describe it as a Pandora's box, because me, when I first opened that email, I never would have imagined all the experiences I would have had, all the knowledge and insight I would have gained. And so I'm always describing it as Pandora's email. Oh, I just opened Pandora's email. And yeah, we just talked about so much. We gained so much insight. We talked about how Jasmine was saying, cultural competency and really how to advocate for your community in the seminar, in the clinic class. Because that's what you do in the student-run clinics. You advocate for the community and your patient. And yeah, one talk that particularly stood out to me was by Dr. Lisa Miller. She's from Human Development, and we just talked about the ethics in end-of-life care, because a lot of the patients in Clínica Tepati are older, and we just talked about that. And I just remember, this is just, after she gave her talk, I just remembered, reaching out to her and saying that I really enjoyed her talk. And little did I know that after I said that I really enjoyed her talk, I would be a research assistant in her lab. That just totally happened, and I never expected this. I'm just wow, this seminar is doing everything for me. And I just after that, I just immediately I just thought about that email and just thinking back, why was I so hesitant to go to South Hall? Why was I so hesitant to go to these kinds of seminars? And then I just think about how as like a woman in STEM, it's harder to reach out for help. And just me personally, if there's something I can find out myself, I'd rather do that because it's more comfortable for me personally. But this class truly, you really don't know what you're missing with this class. It really brings the resources to you directly, and that was even better for me because I didn't want to ask for help. They gave me information that I didn't know I needed at that time. And so they just brought all the resources to me. They gave me all the tools for me to succeed personally in all kinds of directions of healthcare that I didn't even know existed, and all the freedom. And I felt I had the tools and the resources and the freedom to succeed. And the only thing I'm missing now is just the direction to go in, which is for me to choose. And so that class just really opened my eyes. And you really don't know what you're missing until you go to these classes. And now I'm a volunteer at Clinica Tepati. I am a board member of CHE, and I'm contributing now more than ever because of all the things that I've learned in this class. And I'm a research assistant. And Jasmine and I even we love these topics so much that we did our own student-led an extension of these seminars, and it was completely student-led, and it was discussion-based, and that was just really great. So the opportunities and the leadership that this class has given me, and I'm sure a lot of my other peers, is truly invaluable. So I just really highly recommend this seminar and hope that it continues.
Before we move on, I just realized we didn't tell you who we invited. So just so you get a sense of it, we invited several different primary care doctors. We invited psychiatrists, ophthalmologists, medical students came and talked with them, MD, PhD students came and talked with them.
And even a lobbyist, a healthcare lobbyist, who offered all the students the opportunity to go to the legislature so that they can advocate on a bigger level than one-on-one.
And I believe some of them actually also came over to the medical school also for a tour.
Hi, everyone. First off, thanks for being here and sticking it out towards the end. We really appreciate it. I know it can get tiring sometimes. My name is Donna. I am going into my third year as an undergraduate here at Davis. I'm a biological sciences major and Middle Eastern South Asian Studies minor. I was fortunate enough to be able to take both of Barbara's seminars this past school year. And I just wanted to highlight some of, the benefits that it had for us students, which were really, really priceless. First off, I wanted to talk about the mentorship and networking opportunities it gave to us. Right off the bat, when I entered the seminars, I was able to connect with the student assistant that worked with Barbara to run the seminars, Gabby Solis, and she introduced me to an organization on campus called Minority Association of Pre-Medical Students. And I immediately became an active member. It really gave me the proper network to connect with a lot of students that were going through a lot of the same things I was going through, and at the same time, they were really different, and it just bonded us together as a support group. And now I'm fortunate enough to be on board of that organization, so, that was an immediate benefit that I had. I am also part of Imani Clinic, and that is actually how I heard about the seminars. I was in clinic and I got an email and it just seemed perfect. I thought it was something that I really needed, something that I could use so much more out of, and I thought it was so unique. I had never heard of something like that before, so that was the reason why I decided to join, and I obviously don't regret it. I'm here today. So aside from, the things that it connected me with outside of the seminar, inside the seminar itself, we were just given such a safe environment to voice our opinions, and I think a lot of the times we, hear about this and that and healthcare problems and this crisis and that crisis on, TV or reading articles, but we don't really think about sitting there and creating our own opinions about it and having people listen to us about these things that we're learning that are so crucial for us to be, future healthcare professionals. And that's really what we were able to do. We advanced in our communication skills with so many different professionals that came in every single week that there's no way we could have had access to if it wasn't for the organization of the seminar. So that really, really helped me, hearing my own thoughts and opinions about these things that we had to learn about. It motivated me more and made me realize I can, have a role in this. I can have an opinion and I can voice it and people will listen to me. So it gave me that confidence, and that was really awesome, really, really priceless experience for me throughout the seminars. Outside of the seminars, once again, like Dr. Lattimore mentioned, a handful of us were able to go and take a tour at the med school. and had lunch one-on-one with a handful of the medical students. And, it was great having them come into our seminars and, talking to us there. But for us to be in their environment and be put into their shoes and see where they are every day and where they work their magic, and having us show what they do on a daily basis in order to get to where they want to be, that was really, really amazing to see, for us to be able to picture what we have to do and where our paths are down the road. And it also just, helped us see how many different backgrounds of medical students there are right now in medical school who have come there. There's not just one straight path, there are individualized paths for every single person. There's so many different ways to get there, and we really enjoyed seeing that. It was really eye-opening that it's, really possible for everybody. So those are some of the highlights, and I also want to share some quotes that are from the students' final reflection papers that they wrote at the end of the seminars that are really, really inspiring. First one is, having had the opportunity to speak to physicians and medical students and be encouraged to pursue medicine is something that I am truly grateful for. This seminar has helped me recognize the real reasons why I want to become a physician and has given me the inspiration to pursue medical school and to be a better student, volunteer, and person. Another quote is, being the first generation in the U.S. and in college, I followed the advice of the people around me, as I didn't have anyone in my family to turn to. Hearing Dr. Lattimore's story reminded me of my own. It was so similar that it almost brought me to tears hearing it. It really inspired me to never give up, because each person has their own story and their own path to take. And no matter how crooked the path is, perseverance, hard work, and determination will get you anywhere. Another quote, not only did I learn a lot about what it takes to become a medical student, I've strengthened my relationship with the pre-med counselors. I've learned that there are many influential voices on this campus that I was unaware of before I took this class. Next quote is, after being in this seminar, I learned so much about the student-run clinics in Sacramento. After hearing of one of their openings as a translator, I applied, and I am now part of Imani Clinic. And the last quote I would like to share is, becoming familiar with other students in my position was a great way to create a small community that has similar desires and wants to help each other. Overall, this class has been a major element in my college career and is forever going to be the starting point of my path towards medical school. Thank you.
So we have about 10 minutes left. If anyone has any questions at all for our panel, including myself, we're open to that. Does anyone have any? She's going to bring. And while he's bringing that to you, I really want to stress, it was amazing to me how having this seminar not only encouraged the students, and I'm sorry, something we forgot to mention also, is like all my other programs, this program also, we targeted people from socioeconomically disadvantaged backgrounds. The population that tends to need the resources the most, and unfortunately quite often are not the ones who are willing to seek them out. What was a byproduct, a very positive byproduct, was not only the people in the course started seeking out the resources way more than they did before the course, and that is very clear to me, that it really encouraged them to start knocking on those doors, but even their networks who had not actually seeked out the resources were beginning to show up and feel that it was safe to engage.
For referral purposes, when are the seminars going to be offered, the upcoming seminars, and are they restricted to any particular majors or open to all, and how many students will you be taking?
Our Arnett Bates, as I said, the director of our EAP program, sent an email to students.
Okay.
Because we were trying to obviously have the students benefit who needed it the most. And we're in the process of finalizing which seminars we're going to be offering in the fall.
Okay, fantastic.
And so my email, all of our emails are on there, and you can just email us.
And then just one more question. Will there be a cap as to how many students can participate?
These
Do you
were
know?
done through the Center for Excellence in Teaching, and so they cap it at 20.
Okay, great, thank you.
And the way we run the seminars, more than 20 probably would not facilitate the conversations we want to have.
It was a very small, interactive, supportive group, and that was the goal, was to have it be a very intimate setting, so that even if I wouldn't even call them speakers, because anyone who came to class was a part of the group, and that's where it's different It wasn't about PowerPoints and lectures.
Enjoyed the presentation. Congratulations on your progress. So as the person responsible for leading undergraduate recruitment and admissions, how soon, how early, how can we make this part of a recruitment process, you know, for pre-applicants even? I mean, not necessarily the seminar, but just to get connected with a process that can begin to show the pathway, the process. Because I walked in right when you were saying it's never too early.
Well, so I think that's a two-part question. I think one part is, could programs like this be used to actually attract talent from socioeconomically disadvantaged backgrounds? And I think the answer is absolutely yes. I think that people who come from these sort of backgrounds, if it's very clear to them in the recruiting, courting process that there's going to be true support for people like them, that will go a long way. So I think that was question number one. Number two, I think it's never too early for students who, and we can identify who they are, but students who we think might struggle upon arrival, to identify them and link them to programs like this to have a higher chance of ensuring success. And for me, success is they don't have such a hard time in those wonderful Weeder courses that they drop out of pre-health, whatever that is, or drop out of the STEM sort of majors. Did that answer your question, sir? Yeah, I think you're on the right track. Okay.
So I actually have a question for the students, and it was in reference to something that Elizabeth said, as far as thinking of something like this as asking for help or just asking for help in general. So as an academic advisor, if we want to recommend something like this to a student and we're getting that kind of resistance, how would you advise that we frame it, or we advise them so that maybe it doesn't sound like asking for help and that they'll go do it?
I think it takes a lot of work from your end necessarily. I'm sorry to say that, but it kind of does, because, you know, us as like a student, we find it difficult to go seek out for help, like you said. And I think just like the seminar, how it brought all the resources to us, I think if you were to connect with, for example, like CHE, like orgs that deal with minorities or populations, underserved populations, if you were to reach out to those kind of populations and just talk about workshops, because these kinds of pre-health orgs on campus, they really accept this kind of like workshops and help, because they really want like each individual member to succeed. And so I think that once you just do the first step, we will groups like CHE would definitely open the doors for you and like really be excited to have you, because what we really want is the ultimate success of like us as CHE, as a group, as a collective, and and us individually. So there's no resistance to us gaining new knowledge. It's just reaching out that's difficult, I feel, and just if you were to just if any kind of group were to just knock on the door, then there'll certainly be an answer.
The other thing I would say is that at least I found very helpful with our postbac and our MSPP program is in that conversation making it very clear how successful the students who utilize the program are relative to like students. And that, again, when they really hear, I mean, you don't have to couch it as support, but bottom line it is, and it's getting them to where they want to be in the long run. A much higher chance of getting to where they want to be in the long run, at least based on our data so far. Well, for our post-baccalaureate program, we have 80+%, and I am talking about people who clearly come from socioeconomically disadvantaged. Our MSPEP program is a little bit more difficult, but I would say of all the ones who apply, I would say it's about 50 to 60% get in. And again, if you don't compare them to the privilege, compare them to like people, it's extraordinary, our success rates for those two programs to get into medical school.
I'd like to add that there's certainly a commitment by our admissions leadership and the dean of the medical school to bring in medical students that are from our own communities. And I am happy to announce that this is, in the past 5 years, this is probably the largest cohort of UC Davis alumni in our medical school class, probably amounting to about a third. So it's a very large number. And a large number of those students are former volunteers of the student-run clinics. Now, don't rush out and advise your students, you got to get into a student-run clinic to be admitted to the medical school. That's not the case, because we certainly don't have all the spots. But when the admissions committee is reviewing an application, they're looking at the application in its entirety. So I will say that UC Davis and student-run clinic experience is a good combination, but I'm not going to say that it's definitely the way to get into the medical school.
Any other questions for us? Does anyone in the group have their own sort of collaboration pipeline program that's which you've reached kind of across the aisle or the bridges that you would like to share? Hello.
My name is Harold Stewart Carvalho, and I work with the UC Davis Early Academic Outreach Program, EAOP. EAOP is a 40-year program. There's one at every single one of the UCs. And we've had a really great relationship with Dr. Lattimore and the UC Davis School of Medicine over the course of, well, since 2008 with the Health Professions Saturday Academy program, where it has morphed and evolved into a program now that's specifically working with high school age students whom they're in our sphere of influence, and we work to try and engage. And for the past 2 years, we have been recruiting specifically ninth graders and bringing them back each year. And we've gotten to the point now where, you know, thanks to the welcoming arms of not only Dr. Lattimore and his staff, but actually also the program to whom it belongs, and that is the medical students. The Health Professions Saturday Academy program has been really opening up doors and providing aha moments to high school students. Specifically in our programs, EAOP, we serve about 3,000 students in the region. But now, thanks to the School of Medicine, they want to reach out and work with us a lot more closely, not just with EAOP, but with the federally funded TRIO programs, Upward Bound and Educational Talent Search, so we can draw from an even larger pool of first-generation URM students who might have an interest in this field. So again, I just want to give thanks to the School of Medicine for your ongoing collaboration and work with us to try and get more high school students early identified and engaged in this field. And of course, hopefully the hope that EAOP has, and of course the School of Medicine, is that they will actually come into the health professions through a related major once they actually come to college. So thank you.
Thank you for mentioning that.
We have survey results. If anyone is interested, we have some of the highlights of the surveys that students.
Okay, well, I'm sorry, this one. Yes. We have a little bit more time.
Okay, thank you. You really got me thinking here about this. I work at the pipeline level with K-12, and specifically with some school districts in the Central Valley who are, 3 of whom are forming these career tech academy models, which you may or may not have heard of, that are designed to increase retention at the high school level, but also to the extent that the students graduate eligible to enter a 4-year degree program. And part of the way they're doing that is collaborating with community colleges so that through concurrent enrollment, students start to get the actual technical education and their focus is in agriculture and health. Those are the 2 areas where they're really choosing to do this work. 3 of the districts have chosen health. And so I'm wondering if this is a model that can be retooled so it's appropriate at a high school level, drawing upon members of the community to be those expert resources to come in and facilitate the conversations that you have. And I just want to hear your feedback. Is this something that I could maybe talk with you about, Barbara, to see? You know, I'd like to get that conversation started in the districts, because I think it's one thing for them to go sit in a classroom. I think it's an entirely different experience for them to be exposed to professionals who are from their own community, who are people they see day to day, and but they never really have the chance to sit down and talk to them and to find out their story and to talk about these difficult issues that you've brought up, that you've discussed in the seminars, and had those aha moments that you talk about. Because if they could have that aha moment when they're still in high school, but then I think they have an even better chance of getting where they want to go.
And I agree with you. I would just state, in many of the cases, unfortunately, they may live in the same town as the professionals, but they don't interact with them day to day. They don't interact with them at all. And so I think the real benefit of having that kind of a program is they can actually begin to see themselves, because quite often no one in their family is the doctor, the head nurse, the pharmacist. And so, especially at a high school level, I think that aha is, oh my God, I actually really could be this, even though there's nobody else in my family who is this.
I think the power of it was that, and I told Dr. Lattimore I might say this, it was all right with him, but one day he came to class and he said, oh, I forgot my presentation. And I said, oh, good. The students don't want PowerPoints and they don't want lectures. They got to see professionals as people. And I remember one primary care physician from the clinics coming, and she was crying. And we were crying with her because she was sharing one of the most challenging patients she had over the years. And it was about seeing the professionals as people and also seeing the obstacles that they had all overcome on their path to becoming medical professionals. That was very powerful. Whether it was Dr. Lattimore's story or we had medical students coming, and nobody's path was easy. And that made a huge impact on the students.
But it's also something in that process, and the students probably could speak to this, where the real aha is when they really realize they could be that professional. Right. Truly, they can be that person. That's the true aha.
I just wanted to add that the small group of students that were able to talk to these professionals, I think it really brought them down to our level. I think sometimes when we're students, we see them as really unreachable, celebrities almost. We're like, how are they, doing what they're doing, and we can't really see eye to eye with them, when you're there from a distance, or you're watching them talk in, a 400-person lecture hall, or, when you're going to the doctor, they seem, very distant. But this seminar really brought them, at the same table as us, and, we spoke eye to eye, and we saw how similar we were. We all had emotions, we all had struggles, and really saw what it took for them to get where they were, and at the same time see our similarities. So it really made it more attainable and more motivating to and gain more confidence in me, and I'm sure a lot of my peers, to see that environment. So I just wanted to add that.
Any of the two students want to have closing remarks before we close up?
Take the mic. I neglected to mention that, and Ed said it perfectly, how there was such a large applicant pool for the student-run clinics. I felt like I easily was a little fish in a big pond and would have easily been just set to the side. The things that I learned in the seminar single-handedly made me the applicant that they chose to interview. And then the things that I was able to say in their interview, given the knowledge from the seminar class, is what made the board members decide to welcome me to the Imani Clinic family. I just wanted to add that without having that knowledge and knowing what is cultural competency, how do I communicate to maybe people with language barriers, things such as that, and health disparities with disadvantaged populations. Without knowing those things, I would not have been able to be where I am today.
On that note, thank you all for coming out. Thank you.